Hi everybody. So today's presentation is on behavioral change theories. And my name is Dr. Norma Hilsman. So just to let you know, the following slides provide just a quick overview of the purpose and application of four of the commonly used behavioral change theories used in healthcare, and a little presentation on kind of what are the pros and cons of these theories that include the self-efficacy theory, the theory of planned behavior, Lewin's change theory, and Kotter's 8-step change model. First one is self-efficacy theory, and that was created by Albert Bandura, and I've included the original citation here on the slide. The purpose of Albert Bandura's theory was that it focuses on an individual's belief in their ability to succeed in specific situations or accomplish a task. It's a belief that they can do it. Some key points is that it boosts confidence and motivation through evidence of self-efficacy and encourages perseverance. It has four key concepts. One is mastery experiences, which is successful experiences that boost self-efficacy, while failures decrease it. The next one is vicarious experiences, and that is observing others successfully. Completing tasks can strengthen beliefs in one's own abilities. And verbal persuasion is the third one, and this is an encouragement from others that can enhance their sense of self-efficacy. And physiological and emotional states. And this is positive moods that improve our sense of self-worth or self-efficacy, while stress and fatigue may diminish it. Some pros of this particular theory is that it empowers individuals and it enhances motivation and perseverance, whereas some cons is that it might actually overlook some external factors that might influence the participants and requires high self-motivation. An application example would be a nurse education program that includes confidence building exercises to enhance student self-efficacy in clinical skills. One of them would be a simulation training, and it uses the simulation in nursing education to build the students' confidence in handling emergencies. And the supportive feedback would be giving that constructive feedback to nursing students to enhance their belief in their skills. The next one is the theory of planned behavior. This one is by Azgen from 1991. The purpose of Isaac Azgen's, I always struggle to say his name, sorry, Azgen. This theory predicts deliberate behavior by considering attitudes, subjective norms, and perceived behavioral control. Some of the key points is that it integrates social influences and combines attitudes and behavior. So some of the steps that are included is step one is the attitude towards the behavior. Is it positive or negative? And the person's evaluation of performing the behavior. Subjective norms. So looking at society's perspectives and pressures to perform or not perform the behavior. And then perceived behavioral control is the individual's perception of their ability to actually do the behavior. Some of the pros and cons. So pros would consider social influences, and it integrates attitude and behavior. Whereas the cons, it assumes rational decision making, and it actually might not account for spontaneous behavior. An application example would be implementing a new hand hygiene protocol in a hospital by addressing staff attitudes, perceived norms, and control over the behavior. So the attitude would be to educate the staff on the benefits of hand hygiene. Some subjective norms would be to promote a culture where hand hygiene is the norm, and perceived control ensures easy access to hand hygiene resources. Lewin's change theory from 1947 was developed by Kurt Lewin. This theory explains change management in 3 steps: unfreeze, change, and refreeze. A couple of key points is its simple and structured approach. It provides clear stages for change. So the steps of unfreeze is to prepare for the change by understanding the need for the change and awareness, and breaking down the existing status quo. Change is implementing the change by introducing new processes, behaviors, or even ways of thinking. And then refreezing is solidifying the change by establishing stability once the new ways are integrated into the organization. Some pros and cons. Well, the pros are simple. It's easy to understand. It provides clear stages for implementation. But the cons, it can be a little too linear and may not account for complex changes. So an application example would be introducing a new electronic health record system into a hospital by preparing staff, implementing the system, and solidifying new practices. So the unfreeze would be preparing the staff for the new electronic health record system by explaining its benefits, making them aware of it and the purpose for it. The change would be the implementation of the electronic health record system and training the staff on its use, helping them to become familiar and comfortable with it. And then the refreezing would be integrating the electronic health record system into daily practices and ensuring its continuous support and comfort. The last one is Cotter's 8-step change model from 1996. The purpose is that it was created by John Cotter for outlining 8 stages for successful organizational change. Some key points is that it's comprehensive and detailed. It emphasizes communication and leadership. The steps include creating urgency, so it highlights the need for the change to motivate the action. 2, it forms a powerful coalition, so it assembles a team with enough power to lead the change. 3, it creates a vision for change and develops a clear vision to guide the change efforts. And 4, it communicates the vision, shares the vision with everyone involved in the change and everyone that would be participating. Number 5 would be to remove the obstacles, so it helps to identify and eliminate barriers to change and looking for ways to overcome them. 6 is creating short-term wins, so it plans for and creates visible short-term achievements that provides that motivation and momentum. Number 7 is build on the change. So that's continuing improvement based on the momentum of early wins and that positive encouragement. And then 8 is anchor the changes. This one's very similar to the rephrasing phase from the last theory. It embeds the changes into the organizational culture. Some pros is that it's comprehensive and detailed, and it emphasizes the inclusion of communication and the importance of communication and the emphasis on leadership. The cons is that it can be time consuming and it requires strong leadership and commitment. A hospital example would be that a hospital improves patient discharge processes by following Cotter's 8 steps, from creating urgency to embedding the changes into the hospital culture. So first step in the urgency would be to highlight how poor discharges lead to readmissions and patients' dissatisfaction and higher costs. The next one would be the coalition and bringing key stakeholders together, including the staff involved in the discharge planning, and some people might even say involving the patients in the awareness phase. 3 would be creating a vision, defining a clear goal, such as safe and efficient discharges for better patient outcomes. The next would be the vision, and communicating that vision would be to share the plan through meetings, emails, visuals, educational modules, patient involvements, whatever that may be, using examples to inspire. The 5th step would be removing the obstacles. So we've identified maybe some problems that have precluded this success in the past. So we're looking and solving issues like unclear roles or insufficient training to streamline processes and what we can do to overcome those. 6 is short-term wins. So celebrating those quick successes like reduced delays or smoother transitions that might lead toward our ultimate goal. And then 7 is building on change. So expanding improvements hospital-wide, using feedback and progress tracking, seeing how it's actually rolling out and being implemented. And then 8 is the anchor changes, is we've identified the success, we've built off of those short-term wins, We've expanded it, and now we're going to make efficient discharges part of hospital policies, training, and evaluations. So since this is a recording, we're not going to do the group activity, but I would encourage you to consider discussing these theories and thinking of the relevance and application to project development. Maybe asking yourself some questions. What are some things that change theory prompts you to consider when implementing a change or a project? Or change theories are often based on the assumption that the environment is stable. And how might the instability we are experiencing in the current healthcare system and other systems impact the change project you're planning? So understanding and applying change theories is essential in nursing and nursing education to improve practice and patient outcomes. Each theory offers unique insights and approaches. The self-efficacy theory focuses on individual confidence. The theory of planned behavior integrates attitudes, societal norms and expectations, and perceived control. Lewin's change theory provides a structured three-step approach in its simplicity, and Cotter's 8-step change model offers a comprehensive roadmap for more organizational change. I hope that this has been beneficial to you, and I thank you for your participation.